name is Natalie Bogerts.
And I'm Tyler Calder.
And we're both members of the Pomona Student Union, the host of tonight's event. So the Pomona Student Union is a nonpartisan, student-run organization dedicated to promoting honest and open dialogue in order to challenge the assumptions of students and the wider campus community. We hold discussions, debates, and panels such as this one with a variety of speakers with the goal of stimulating conversation and creating an environment in which multiple viewpoints are represented. Please visit our website for more information or to view videos of our past events.
So before we begin, we wanted to start with a few questions. So first, raise your hand if you like food. Come on. Raise your hand if you could define what a food desert is.
Wow, that's a lot of you.
Raise your hand if you think you live in a food desert. Baby hands. Raise your hand if you can find healthy food within a reasonable walking distance. So as you just see, each of us in this room come from really different parts of the county, country, and the world, each bearing our own experiences and understanding of food, its accessibility, and most importantly, its affordability. Here in the United States, food deserts, or swamps, as I recently learned, are becoming a bigger and bigger issue as our population grows, as communities change, and as industries and companies become primary decision makers. The Inland Empire specifically, the community that we as students of general colleges are a part of, and yet completely estranged from. This discussion of food, the politics of food access, the reality of food deserts, and the solutions that are being implemented are particularly relevant to us and to our greater community.
During this event, we'll hear from our three panelists who all come from very different backgrounds. First, we have Dr. Alex Ortega. Alex Ortega, PhD, is Professor of Public Health and Psychiatry and Biobehavioral Science at UCLA. He's Director of the UCLA Center for Population Health and Health Disparities and Associate Director of the UCLA Chicano Studies Research Center. He's also served as Director of the UCLA Institute for Social Research. Ortega has conducted public health research among Latino children and families in California, New England, and the U.S. Commonwealth of Puerto Rico. His work has been funded by multiple institutes of NIH, AHRQ, the VA, and private foundations. He's a recipient of multiple research awards, including Distinguished Nationally Known Health Professional Award by the Latino Caucus of the American Public Health Association. Prior to his UCLA appointment, he was on the public health faculty at Yale University.
Next, we have Claire Fox. Claire Fox is the Director of Policy and Innovation for the Los Angeles Food Policy Council, an independent nonprofit created by the City of Los Angeles to advance food systems policy. She collaborates closely with a larger network of food advocates, representatives from the public and private sector to catalyze progress and build leadership capacity for sustainable and equitable food system in Southern California. Her policy areas focus on food access and equity, urban agriculture, street food vending, and food-anchored community economic development. Claire directs the Healthy Neighborhood Market Network, an initiative to bring businesses and leadership development opportunities and consulting to neighborhood markets in low-income communities who wish to sell more fresh and healthy food. In 2011, Claire co-created the Community Market Conversion Program at the Community Redevelopment Agency of the City of Los Angeles and coordinated a 4-store pilot in South Los Angeles in partnership with the LA County Department of Public Health. Previously, Claire worked on a wide range of community, environmental, and labor organizations as a research, strategic planning, and facilitation consultant, including projects for the UCLA Labor Center, the LA Community Garden Council, and Green for All. For several years, Claire produced and taught radio production to young people throughout LA and the US for youth radio and NPR. Claire has a bachelor's degree from Magnolia College and a master's in urban planning from UCLA. All her work is informed by over a decade participating in grassroots movements for social and racial justice.
Finally, we have Ron Finley. Ron Finley is the co-founder of LAGreenGrounds.org, a company that brings vegetable gardens to local neighborhoods throughout LA. He's winner of the Natural American Heroes Award and is a recognized community leader. Having grown up in South Central LA, Finley is familiar with the idea of food deserts in the city. Finley fought against the City of Los Angeles for the right to garden and grow food in his own neighborhood after he received citations and eventually warrants telling him to remove his gardens, a fight that he subsequently won. His 2013 TED Talk catapulted him into the media spotlight, a role he has since used to promote urban farming and healthy eating within his community. In addition to his work on gardening as a form of community building, according to Wikipedia, Finley is also a fashion designer and collects original blaxploitation posters.
So to begin tonight's event, we wanted to ask each panelist a question that's a little bit more specific to their particular area of expertise. And then we'll give all the other panelists a little bit of time to add on or respond to each kind of thing. So we're going to begin with Dr. Ortega. So understanding the context of food deserts in the LA area is really important to helping us find and address the root causes of the issue. Could you give us some background on the history of food access issues in LA? When and how did they emerge as a problem? And yeah, perhaps focusing on your specialty with friends that we see throughout the communities.
Sure. So, food access in low-income neighborhoods in Los Angeles has been a problem for some time. So this is not a new problem. And there have been a number of strategies that have been implemented by the county and by other stakeholders to try to improve the food environment in low-income neighborhoods. What my group is engaged in is what we're doing is we're converting corner stores in East Los Angeles and Royal Heights, which has been defined as a food swamp, or as Ron might call them, a food prison. And a food swamp is different than a food desert, where the idea is that a food desert, there's an absence of food. But in a food swamp, there's food, and there are even grocery stores in food swamps. It's just that there's an abundance of unhealthy lots of venues for unhealthy food options, such as fast food restaurants. And in East LA and Royal Heights, there are something like 150 corner stores. And these are not your 7-Elevens, these are your mom and pops, sole proprietor owned corner stores that often sell, chips and liquor and lottery tickets and cigarettes, and they'll sell some pre-prepared foods. They might sell some refrigerated fruits and vegetables, but they tend to be of very poor quality. And so what our group is doing is we're trying to convert many of these stores so they become healthy assets for the community. But I'm an academic, so I'm not a public health practitioner. I'm more of a public health academician. So what my group is really interested in knowing is what impact these corner store conversions are having on the health behaviors of communities. So does it actually change the health profile of the community? So do people start buying more fruits and vegetables? Are they preparing them in a healthful way when they come home? And is it having an impact on rates of obesity and diabetes and heart disease in the community? So, I don't know if that answers your question.
Yeah, I guess we want to know a little bit about how did it come about that. I'm not, I can tell you by trade, how did the issue of food deserts come about? Sorry. This started, actually the term food desert has probably been around at least in the popular literature, even in academic literature, for about 10 years, although food deserts have been around for a very long time. And in fact, I kind of got scolded. I actually just started talking about food swamps maybe about 3 years ago. I was doing an NPR interview with and the other person who was being interviewed was a health economist, this guy Roland Stern from Rand Corporation. And he's not an interventionist, but he studied data to look at how food access around the country was related to obesity rates. He published a paper in a journal called Health Affairs that found that having access to healthy foods was not associated with obesity rates. And so we were kind of going through some interviews really about the pros and cons of the study. I refer to food deserts in the school and said, no, there's actually food in these places. We refer to them as food swamps. So it's not actually our term, although people like to associate the term food swamps and have to come up with it. And there have been efforts, it's not just in LA, but all over the country to try to intervene on food deserts. Some of these initial efforts were in New Orleans, Baltimore, and particularly in Philadelphia. And about a couple of years ago, Philadelphia, along with the Food Trust, opened up a brand new grocery store in North Philadelphia. It was something like 40,000 square feet to try to improve healthy food access in the North Philadelphia food swamp. And a study just recently came out that showed that, lo and behold, even though there was all much effort and money spent on opening up this brand new grocery store in this food desert, food purchasing behaviors in the community did not change. And so our group is really trying to, interested in how we can
Because as we know, it's not just about building grocery stores or converting corner stores, but you also have to do there are other parts of the intervention, such as social marketing and health education that needs to happen in order to drive foot traffic to the stores to change behaviors.
How did they start? I mean, to me, they're by design. Because what you find is if there are a lot of black and brown people in certain neighborhoods, there is a lack of healthy food. One of the reasons that I did what I did with growing food on the street was just to show people they're not going to bring food here. It's not going to happen. This is, are you going to sit around and wait for it to happen? Or are you going to become, your own savior? Now it's my whole thing. Bro, don't bring food, create and design your own life. That's where I came from. I mean, you have these kids eating this garbage from day one. In the schools, they know that this food has no nutritional value whatsoever. So how the hell are you going to expect a child to mind to develop, their body to develop? It's not going to happen. So to me, with this whole food issue, to me, it's like I tell people, I don't grow food, I grow people, and they grow food. Because to me, the lessons are in the soil. And you have these kids that they don't, you're a child, you don't know that you're being bamboozled. And the food is, the schools, they know that this is garbage. So to me, that's why I'm saying that's why they have proof of concept that this is working the way they want to work. To me, schools are not the incubators for the prison system. And that's why I started growing food. I live in South Central, but I travel around this country now and everywhere. We created a new medical industry, diabetes center. If there's a brown or black community, you can't find an organic apple, but you can find a black diabetes center. And that's what I set out to change. I want this to be, I want people to take their community into their own hands and their lives into their own hands. And to me, it all starts with food. So that's how I got up here. It's, I tell you, you have 4 corners, but they have 6 fast food restaurants in 4 corners. I don't know how they do that shit, but they manage to do it. So that's why I'm here.
Yeah, just building off of what Ron was talking about, that unequal access to healthy food is symptomatic of larger patterns of unequal development. So for the same reasons you see some communities don't have quality schools or access to health services or access to banking and financial services. It's the same sort of meta structure and patterns of development of inequity that are organized around race, organized around class, organized around gender. And so historically, when we locate sort of the food desert concept now, located in its historical context, it goes way back, right? I mean, it goes into the foundations of this country and slavery and oppression, systems of oppression. But we could also look just into the last few decades and urban development patterns and what happened in the 60s and 70s when there was a lot of social transformation, civil unrest, a lot of protests, a lot of people demanding that there was equal access to the resources that every community deserves. And what you saw was a lot of white flight from the cities. And so a lot of middle-class families, a lot of white families leaving urban centers, and with them, a lot of resources and development. And so that was sort of the beginning of the large supermarket format, because there was more land available in suburban areas. It was easier to do permitting. And so what you saw then was a gap in food retail services. That's where a lot of the neighborhood markets and the corner stores and the liquor stores started to fill that gap. So just wanting to offer that sort of additional historical context of why food deserts are the way they are now.
Thank you. Now we'd like to turn our focus a little bit more to what the role of individuals and communities and maybe communities play in alleviating issues around food access. So Ron Finley, I think we'd all like to hear a little bit more about your ideas on community action and leadership to affect social change, especially in regards to food access. What you see working, what hasn't worked.
Well, my thing with food is it goes beyond. I'm a gardener, just like I think we all are, because it was the first position supposedly on this planet. The guy said they would take every garden. You know the rest of the story, the woman and then the snake and eating this and now we got plastic. You know. So, I started gardening because of it became my solace, it became my meditation, and I wanted to share this with other people. I wanted to share this with my neighbors, my neighborhood. But first of all, I wanted to bring beauty to my street. You know, you have these streets, and I had just this grass, and people would leave their condoms and their trash and their toilets and their dressers and nothing, it was cool. The city didn't do anything, but I planted a carrot in the ground and all hell broke loose, Like, okay, we got a black guy planting food on the street. I think we need that, So it was like, they came down. So my thing was, you can't tell me that I can't grow food here, because you're not maintaining this, and I'm not a cow. I can't drink and eat grass and you mow the grass and water and throwing all of this, all these things that are worth money into something that does really nothing for you, and especially water in this city. And I just said, I'm grow food and I farm. I believe that food is a cornerstone of who we are, and not just food, healthy food. A lot of you guys, you might not even know it, that you got these supermarkets, and a lot of them, it's nothing but garbage in there. We had a supermarket leave our neighborhood, and everybody was crying and what they should do. The supermarket. I said, the supermarket owes you nothing. As a matter of fact, let's help them move the hell out of here and put in the market that we want to. And I think that's the whole thing with me, with gardening. I'm not trying to turn everybody. I don't want to turn everybody. Everybody shouldn't be a gardener, but you should. It's a life skill. Just like cooking is a life skill. Everybody needs to know how to do it. And that's what I'm doing. And I've seen it turn people. I've been fortunate lately to travel around the world, and it's everywhere. Food is a problem everywhere. We have our biggest import is obesity. that's America's biggest export. Not import, export to other countries is obesity and diabetes. You have countries where people used to eat a certain kind of food. Now they don't. It's all about convenience, and that's my whole thing is change your food, change your life, and that's what I want everybody to do. I want everybody to take their neighborhoods and realize that you have a stake in this neighborhood. Don't wait for somebody else to change it. And with what I've known with food, it's brought conversations that I would never have had with my neighbors. It's brought relationships that I've never had before with my neighbors. But the biggest thing is you create an ecosystem, whereas you create life for birds and dragonflies. And these, I wake up in the morning, every morning I see a hummingbird. That I love that. So that's what I want everybody to experience. That I always keep sunflower planted, and I notice how it just changes people's total mood when they see it. It's impossible almost to see a big ass sunflower and not smile. You got some big 15-foot sunflower, and it's like, what the hell is that? But it changes people, and that's my whole thing. I just want to share that with everybody. I want everybody to know that you don't have to live the life that they have already designed for you, because part of that life is confinement. And I just wanted these kids, I'm talking to these kids, and you put them in the soil, and a lot, it just changes their life, and they will eat right out of the ground if they grow it. So that's what I'm doing, and I've seen it change communities, so that's what I'm doing.
As you try to break out of this environment we've been talking about, have you found government, private enterprise, help immigrants, how
Well, I mean, the city helped me, you know, after I embarrassed their ass, but, you know, because when they, you know, I mean, and they were clocking me, they were clocking my progress. Mind you, I didn't, none of this with me was planned, you know. So I created a lot of haters too, so, but embrace your haters because they make you famous. And you get to travel all over the world. And with that, now they help. Now, I mean, my councilman is building a park, you know, named after his wife. Now they support me. Now, if, you know, like I had somebody in one of my friends who had a garden and got one of the guys in the city, you have to take this out. You have to take it out immediately. We're going to do this. This is going to happen. And then she called crying. I'm like, so we got involved in it, and once the city heard that I was involved, it was like a Jedi mind trick. So there's nothing that we see. We're not going to enforce that. Don't worry about it. You know, so it just shows you that they're on board now, and a lot of times we have to keep these politicians face to the fire, and no, not feet to the fire, like Warren or try to correct me, face to the fire. I believe if your face is on the fire, your ass is gonna operate a little faster than if your feet was on the fire. You know, and so we elected these people. So we have to realize that we have the power. And I've seen the change, and I see it every day. And I just want to keep this change going all over the world. Did that answer your question?
The only thing I would add is that we work a lot with high school students in East LA and Royal Heights, and also in other parts of the county. And these kids, I mean, many of them, and you talked about this, have actually referred to it as food literacy, their knowledge about whether they can read food labels and their knowledge about calories and fat intake and sugar. They actually have really high, even these kids, you would think that, these black and brown kids actually have pretty good food literacy. But they still want to eat the chips and the sodas at these corner stores where they're frequent patrons at these, they go to the fast food restaurants. And so it's really about like how do you get them to change their behavior? This is an old story in public health. So how do you get kids to start behaving more healthfully? And what we did was we changed the framework. So we didn't go in there with the traditional model of you got to eat your fruits and vegetables, you got to do this and that. But rather, we framed it as a social justice issue. That there are health disparities in your community that impact your longevity, your illness, the health of your family, whether or not you're going to succeed in life. So we really had framed it, we turned it around, and we were able to get the kids really engaged and excited about food deserts and transforming their food environment by reframing the issue. And you got to be creative.
You gotta make it sexy.
Gotta make it sexy.
If it ain't sexy, they ain't gonna want to be about it.
Well, and policy is really not sexy. So one of my favorite parts about Ron's story and what happened with the growing food in the parkways was that it really just galvanized people. Like urban farmers, you cannot tell an urban farmer what to do, and you cannot tell him or her that she cannot grow food. It's just inane. So people were really energized about it. Sort of like it's preposterous. And I think it's really important to maintain your vision and your ideal, and to not get sucked into,
but it's just not possible on this level because the zoning of this and et cetera, the liabilities,
because that's what the city, came back with initially, right? I mean, initially it was sort of like, but what if someone slips on an eggplant and, that's a quote. That's a quote.
Please don't give me that kind of material to work with. Please.
It's too good. It's too easy. But I think, but that said, what we were bumping up against was a legit policy question. So we did need to change the LA Municipal Code to allow for growing food in the parkways. And you would think, you know, it's so logical, and yet it took, almost 2 years. So for something like that, and that's the beginning of the journey. But the good news is that policy activates people, right? So if you can stick with it, you can have that endurance to continue to engage, keep their face to the fire. It does pay off, and it builds momentum, and it builds leadership, and I think it's just important to always engage with elected officials in the city. And my organization was created by the City of LA, so we have very close relationships. But to not drink the Kool-Aid, so to speak, but really continue to say, we can do better. I believe in you, City of LA. Let's do this. And then, of course, when you put them on blast through, viral videos, through TED Talks, then they really pay attention. But now they're tuned in, and like Ron said, now they're more cooperative. So those are the opportunity moments.
So Claire, I think people have acknowledged that food access is a problem in LA. So what kind of methods and policies have been implemented in the past to alleviate the issue? So what's the city currently trying to do? And have there been some hiccups in that policy implementation? Have there been times when programs like flat out failed?
Oh yes. There's always going to be hiccups. That's the thing. So from my standpoint, as someone who believes in social change and social justice, you have to consider that it's a marathon, not a sprint, and keep your eyes on the prize. There's always going to be hiccups. Policy is not sexy, but you can have fun while you're doing it, and I think that's really important. So some of the approaches, just building off this conversation about edible parkways, that was an important change, because a lot of neighborhoods, especially in cities, it's a dense environment. There isn't a lot of land to grow food. And so folks like Ron and other people were growing food where they could and beautifying the neighborhood in the meantime. So that's an easy, simple solution right there. That said, in many low-income neighborhoods, there's also a lot of vacant, unused land, underutilized land, and frankly, sometimes it's the city itself that owns that land, which is particularly egregious, right? Because it's publicly held land, it's a public resource. Why is it just sitting there vacant and unused when it could be a flourishing garden or urban farm? So that's a policy area that the Urban Agriculture Working Group of the Food Policy Council and other folks are really taking a look at that. And building off of the success around edible parkways is, how do we hold the city accountable to the use of its own properties, particularly in low-income neighborhoods, and really make those lands available through an easy leasing system, and first of all, publishing information about where those properties are available to convert them into gardens. So again, that's just kind of a no-brainer, but believe it or not, it'll take years to do. And then we're also looking at it from the point of view of privately held land. So many of you might be familiar with this concept of like absentee owners, and in low-income neighborhoods, people who are just kind of holding on to property, waiting for a development opportunity. And in the meantime, it's a real drain on the neighborhood. Visually, it's blight, and it's bringing down the value of properties in the area. Well, the state of California passed a law called Urban Ag Incentive Zones Act, AB 551, just last year. And what it does is it would actually provide a tax incentive to landowners that have vacant property if they open it up for food growing. So that could be a nonprofit or a for-profit that activates the land with food growing, with a beautiful garden or urban farm. So there's another opportunity there. So locally, we're working on implementing that. And then I would just say that the other main strategy policy-wise, and talking about some hiccups along the way as well, is around corner store conversions and bringing resources and incentives to existing food retailers. A lot of what Dr. Ortega has been talking about. Well, in California, we used to have something called redevelopment. And there was a lot of problems with redevelopment historically, but it was a way to bring economic development investments into disenfranchised communities, and it was a tool to attract grocery stores, quality markets, restaurants, and to invest in existing retail. And so I think the opportunity, we had a community market conversion program through the redevelopment agency, and then that redevelopment was destroyed. It was literally dismantled. So that's a huge hiccup right there. It's like you have certain policy tools and then you lose them. And then you have to figure out what your plan B is. And I think the work that the UCLA team is an example of how you fill in the gaps. And I think the city of LA, for example, has the opportunity with its new economic development department to come up with some really innovative programming to bring those resources back.
Gotta make it sexy. I mean, there needs to be ordinances, laws for this. I mean, because people will take advantage, like I did, you know, of the property. But I mean, there's safety concerns and there are things like that. But my thing is, in these communities, what I'm trying to get people to do in my community and other ones I have visited is to just get people to realize that how, you know, you can grow your own food, you can build your community yourself, you can have your neighbors help you, you can trade neighbors. You don't have to, it's impossible, you don't have to grow all the food yourself, you know, but start bringing it in yourself and then demand that these politicians change these neighborhoods. And because a lot of these kids, I ask them, you know, a lot of times I talk to kids in colleges and they don't have an idea what they're eating. They don't have an idea what's in these ingredients. They don't know what castoreum is, you know, it's some additive for flavor that they've used for 70, 80 years that actually from like the anus of a beaver, you know, that they put out. If you look it up, somebody get on their phone and it's from, you know, I'm like, hey, anybody want beaver nut ice cream? You know, but it's I mean, and this is the kind of stuff that we're eating. And there's really no reason a lot of these ingredients that they're putting in food, there's no reason, and they're killing us. I mean, they're killing, they're affluent people that they're killing too. So it's not just necessarily a food desert. Everybody, if I asked, like I was in London last week, and the audience is 600, and I asked them how many people in here know somebody that has a debilitating disease like cancer or going through it, and 85% of the audience stood up.
So the only thing I'll add something about this issue of food desert. So food deserts don't have to be in urban environments. They can be rural and urban, they can be suburban. And I mean, although low-income neighborhoods and urban environments are disproportionately affected by food deserts, more likely to be in a food desert. There are neighborhoods, there are places in the Appalachian Mountains that are food deserts and have a lot of white people in them. It's mostly about having poor resources. And then getting back to the issue about using vacant space for food, for gardening, with one of our stores that we converted in East LA, there was an ugly vacant lot next to the store. And we tore up the lot. My students and I, we also got some of the high school students to help out, some of the teachers, and we turned it into a community garden. And the store uses the vegetables that are grown in that garden, and they sell it in the store. And that also allows the store owner to be able to sell the vegetables in the store at a very low price, so that it makes it more available to the community.
Can I say one quick thing? I feel like it needs to be said that, you know, you can't legislate social change and transformation, but policy plays a really important role. So what he's talking about is community leadership that's already there, that's being activated through this amazing community project, and it will eventually, it does bump up against questions of, you know, environmental health permitting, right? Because then the store owner has to figure out, well, how does this get permitted, et cetera, et cetera. And I think environmental health of the Department of Public Health for LA County is a good example of a shifting culture of government, where before they were sort of the regulators and the know people, but now they realize, you know, they have a role to play in innovating. And so as really cool, amazing things come up in communities, as they will, because people are resilient and creative, it's the role of government to take the lead from that and say, okay, how do we get out of the way? You know, how do we get more innovative with our permitting process so that we're not out there telling Dr. Ortega's kids, sorry kids, you can't do this, but rather, okay, yeah, oh, this is new. How do we come up with a new way of permitting or growing food in parkways, for example? So I just, you know, you can't legislate change, but it does play a role, and it's that dynamic dance between policy change and community change and community leadership that's important.
Well, a lot of it too is with us, it's changing culture. We have to change culture. And it's like you were saying, these kids are eating this food, they're eating this food because they have become this food. And this is what their bodies have turned into. This is what their taste buds are. So they don't know what real food tastes like. So we're changing their culture and we're changing the culture of the food they're eating. And that's hard. That's the hard work.
So I guess let's talk a little bit more about that hard work. We're going to go through each of the panelists in 3 minutes. What would you propose as a solution or an important part of the solution to this problem throughout the city of LA? Claire Fox.
So what would I propose as a solution? I really believe in leadership. There's leaders in every community. So a lot of times in these kind of conversations, you know, we talk about food deserts, and a lot of people have kind of contested that term as like, oh, there's nothing in this community. No, there's a lot going on in every community, and there's leaders in every community. So what does it look like to really invest in the leadership that's already there and invest in community leaders like the young folks that Dr. Ortega works with, or in my case, through the Food Policy Council, we run ongoing a resource network and business and leadership trainings for neighborhood markets and corner stores for the whole sector. So we've trained over 200 corner stores, and that's complementary to the kind of market makeover work that's happening that's been described. And I just really believe in that because, you know, then you're activating people's innate sense of their power and agency to create change in their own lives and in their community, and that is what will make any kind of policy change or any kind of community development project sustainable. Because I've seen it all too often, the parachute in, parachute out. Oh, we're coming in, we're gonna do this really cool project. Do you guys wanna be involved? Yeah, woo, okay, have a big party, yay, there's the one-off. Yeah, there's a basket of fruit at the corner store, whatever, and then 6 months down the line, what happened? Where did everyone go? Where's the relationship? And the store owner is sitting there like, crickets, nobody bought it. I'm not bought in. And so we have to interrupt that model. It's about all of us being stakeholders in real transformation. So that's a little, maybe, I don't know, conceptual, but I think it's actually quite practical. Leadership development, capacity building, movement building has to be inherent to everything that we do. And we need to create systemic policy change. But we have to do it in that kind of way. So that's my proposal.
So what Claire had described, we refer to as a SWAT conversion. You go and you spend a weekend. Actually, a lot of these conversions happen with college students, much like you guys. So they come in and they do a paint job and everybody's feeling good about themselves, and they do some reshelving and reorganize things in the store, and then they leave. And the idea is that now we have this pretty little store. People are going to come to it, and it's going to be great. And people are not going to have diabetes or obesity in this community, and they're going to start buying fruits and vegetables, and the world is going to be wonderful. But that's not what happens. And what you have to do in any intervention like this, you're trying to improve the food environment, you have to engage the community. You have to have the community involved. And you need to know, and each community is going to be different. You need to know what their needs are, what their wants are, what their perceptions are, their levels of awareness about foods and healthy eating and how to prepare food. So if you go into a food desert, you start offering a lot of fruits and vegetables, but people don't know how to prepare them when they go home, or they don't know how to prepare them in a helpful way, well then you just lost everything. And I gave you the example of the Philadelphia experiment where, I guess it was technically an experiment, where they introduced this grocery store in this food desert, and then 6 months later found out that people weren't buying fruits and vegetables in the store. Because they didn't do the requisite things that are necessary in intervention to create demand for healthy foods, to create awareness, to bring in the foot traffic. There has to be social marketing in the community. There has to be an ongoing iterative process process of engaging the community and figuring out and tweaking the intervention as you move along. So when we do a corner store, I mean, all of our stores, we've been with for at least 2 years, if not longer. One of the stores we've been with for 5 years. So these are not SWAT conversions. And we have to tinker with things, and you gotta do a lot of education with the store owners, because many of the store owners are, these are, like your parents, they don't know about, not that saying parents don't, but they don't know about social marketing, and they don't know about how to work with vendors and wholesalers to negotiate how to get foods at a low price, and they can sell them at a low price but still make a profit, and how to do bookkeeping, and what do they do with waste, and how do they deal with the refrigeration. And so much of our time is dealt with just the refrigeration alone, like purchasing the refrigeration, which is expensive, but then also getting a refrigerator that's the right size for the store, stocking it, making sure that the store owners continue to stock the refrigerator, and that people come in and buy stuff, and they're not just buying the avocados, or they're not just buying the limes, but they're actually buying the other fruits and vegetables that are available. So it requires a lot of, it's seriously involved, it requires multiple layers, it requires policymakers, residents. We even have law enforcement involved, because there's some crime activity around the stores, and trying to reduce crime activity. We get the schools involved. So we refer to these as multiple or multi-level interventions. You get multiple stakeholders.
Compost. Compost changed my life. I get so excited when I make compost that my nipples get hard. You have to make compost. No, compost, seriously, compost. I tell you, leaves fall for a reason in a particular season. It's by design. It's a natural, Mother Nature, magnificent design. It's simple as hell, but it's complex as hell. What do? We throw them away. I mean, the same thing with our resources like water. What do? We use 2 gallons of water to flush a couple of ounces of urine on the toilet. So now where are we in California? We knew we were headed for this. We're in this hell of a drought. Why didn't we, when they stepped up the game a long time ago, why didn't they initiate some of these changes that they knew would save water? This is why this is where we come in, and we have to be the stakeholders. We have to, our neighborhoods are our responsibility. Nobody else's. You live there, you should clean it. You should make sure it's safe. But everybody's waiting for somebody else to do it. My thing is, it's your neighborhood, do it yourself. And I think we need, like Claire said, we need leaders in these communities that's going to step up. But the hardest thing is changing culture. It's almost like I was working on Skid Row, and it's like, how do you fix this? You got people with mental illness, you got people that are alcoholics, you got families that's just bad in a bad way down there. So you got all this in this cesspool, and how do you fix this? And that's how this is, but it's like, where do you start to fix this? But with that, it's almost the same thing with the communities. They're so entrenched in it's so bad that it's almost like we have to, blow these places up and start all over again. Yeah, I mean, it's because we have, how do we change people's eating habits, whereas overnight, how do we do this? It's going to take so long, because again, we're changing culture. And I think that's the only way it's going to start. We have to start. I think we have to be too. A lot of people say, "Oh, you start with the kids. Yeah, but these kids go home to their parents till they're trying to hear this shit. You know what I'm saying? So it has to be a 2-pronged, 3-pronged thing where we affect everybody at the same time. It's like Doc was saying, you need to have food. You want to have food that people bring in, new food that they bring into their palate that they hadn't seen. What am I going to do with this? I need to know how to cook this. I need to know what do I do? And we have to supply that. And I think that's the only way that this is going to change. And it's through education, but it's also through think building of communities where this is gonna happen.
So my last question, and then we're gonna open it up. So within the Claremont College's community, we're in a really privileged position as college students with access to resources and nutritious meals. So what do you guys think is our responsibility as inhabitants of the Inland Empire, or living in what we often refer to as the Claremont bubble? What do you feel food justice should mean and look like to us? I guess we can also be talking about our generation. Go for it.
I think you leverage the resources that you have to create change, and this school buys a lot of food. So you start with what kind of food is the school buying? Where is it going toward? And this is getting into like larger food system issues and questions, but I'm guessing that if you're here, you're sort of interested in connecting all those dots anyways. But procurement, man, that's where it's at. You're gonna create so much systemic change in the food system by leveraging the purchasing power of this institution to buy food that is healthy, sustainable, fair, grown in a fair way, respecting workers. So, you know, we talked a lot tonight about access to healthy food, but that comes from poverty conditions, right? So you address poverty conditions by addressing, you know, do folks have access to quality jobs and career opportunities? Food workers, I forget the number, but it's some crazy statistic. It's like, I want to say 30-something% of food workers are on food stamps. That's insane. People who are growing food, serving us food, need public support to get food for themselves and for their families. So the purchasing power of this college is the first place to start, and you can do it in a way, you can design it in a way where it's also anchoring community-based transformations in the neighborhoods around here where there might be a need to expand some access to healthy food. So for example, if there's an awesome corner store conversion project happening in a neighborhood nearby where perhaps, you know, there's limited healthy food options, what would it look like for this college to buy food from that store? Of course, the scale is quite different, but even just a couple $100s worth of fresh produce purchases, maybe they go towards just the occasional barbecue or whatever here on campus, is a huge, huge impact for that corner store to be able to thrive as a healthy food retailer. That's what's going to make that market makeover work. So how do you use this college as an anchor institution that really anchors the transformation of those neighborhood projects?
And I would just say, you know, with education comes power and responsibility. And as you guys go on and graduate and become professionals and become outstanding citizens, you know, that you become aware of this and increase awareness, and that you know, push policymakers and to make sure that, you know, that we end this problem of urban food deserts and that and social inequities in health. I mean, that's really up to you guys as a society. You know, we can't just do it alone. It's a collective effort. It's not just public health researchers. It's not just renegade gardeners. It's not food policymakers. It's all of us. It really is multi-level. And so you should use your power as educated citizens in our society to make a difference. And that's not just with food, but with everything. You know, to have a social conscience. And that's very important, to realize that you're part of the collective.
I like to use the Marie Antoinette analogy, whereas, you know, what's happening down the hill, they don't think it affects what's happening on top of the hill. And it does. They get that thing sooner or later that you must smell the stench and it's going to hit you. So, you know, with the Marie Antoinette thing, you know, let them eat cake and, you know, while they're dancing and partying and having all this good food, people were eating garbage. And you see what happened to her. This shit didn't work too well for her. So all these people, you know, on top of the hill that think that this doesn't affect them, it affects you. You know, 9 times out of 10, you guys are probably not eating as healthy as you are at these restaurants because we have, you know, this produce that has been manipulated, it's been sprayed, it's impregnated with all kinds of stuff that you don't want to know about. And it's everywhere. It's not just in the food deserts, okay? It's not just in the hood. It's not just here on the border. It's everywhere. So the food system is everybody's affected by it. You know, all of our health. It's just like we are one. That's just real. We breathe the same air. We drink the water is the same. You know, there's no difference. Yours might be filtered a little better, but that's about it. You know, we're one. We need to start treating each other like one, and that's the only way we're going to break this in just us. Just us. It's an injustice to us, and that's and it affects this whole nation. It affects the world, and the only way we're going to change it is we get together and realize and accept that it's happening. And to me, one of the most unjust systems right now is food. So that we all can change it. We all have a stake in it.
Please join me in welcoming them. Thank you. Section. So if you have any questions you'd like to ask, please go to the center microphone here. As people are coming up, let me just say that if you're interested in any of the issues we've been discussing in tonight's event, we're working with the Draper Center to coordinate a Sagehens Engaged volunteer event with Ron Finley's organization in the next few weeks. And additionally, you can reach out to the Pomona College Organic Farm or to Spread Cooking and Food Justice Club on campus to discuss the issues further. So I was hoping someone would walk up to the microphone while I was speaking there. All right, excellent. Thank you.
One thing that plagues community-based organizations like perennially is a lack of funding. And so in your ideal world, would that funding normally for these programs be public, private, and mixture of both, and how would that work?
To me, a lot of it's not funding. Like again, it's by design. There's no money down there. That's bullshit. If it wasn't no money down there, those medical clinics wouldn't be down there. McDonald's wouldn't be down there. These supermarkets wouldn't be down there. There's tons and tons of money down there. You know, so that money thing is we're being occupied, being terrorized. You know, and they need to just admit this and change that. The whole structure needs to be changed. You know, there's not 4 fast food restaurants on the corner in Brentwood, you know, or here. So this shit's by design. It's just not no perfect storm that just fell. Oh, wait, look at it, it works so perfect. No. Oh, you got this store here, but then there's the dialysis center right down the street. Is there a dialysis center around the corner from here? Hell no. No. But we have that. It's by design. We're feeding complexes. The prison industrial complex, the medical industrial complex, and the agricultural industrial complex. So if there's no money down there, why are we feeding them all?
Yeah, and I think what you're touching on is the nonprofit industrial complex. And for real, and so the question of funding starts to limit our imagination about what's possible and it stops us from seeing the resources that are actually available to us beyond financial resources. Compost, yeah, compost. So, but something Ron said too to follow up, there was a study done about 2011 by an organization called Social Compact, and they actually identified that $113 million leaves South LA and Boyle Heights, East LA every year in grocery retail expenditures, was just to say, yes, there is actually people purchasing power there, it's just leaving their communities, and so it doesn't exactly touch on what you're asking, but it's to reimagine what's possible and what we actually have, what's available to us, and how to be truly imaginative about it. And also just to not let funding determine what we do, period. And I mean, that is the core problem, I think, of the nonprofit industrial complex, is that it's like the grants determine the work. That doesn't necessarily mean you're doing what needs to be done. It means that you're answering to deliverables. So my response to you would be, yeah, a mixture of all of that. And particularly, I think social enterprise models are coming up as really important when you see more nonprofits finding ways to generate revenue and by the value that they're creating in communities as a service, and not necessarily giving everything away for free, but having sort of an exchange of resources. Again, that could not be non-financial resources, but to be truly innovative in that sense and entrepreneurial. I think that's important to have that balance.
Social enterprise and getting sexy.
It's hella sexy, yes, social enterprise.
But most interventions require some upfront money, you're right. So, if I want to convert a corner store, I have to have a refrigerator, and I need stuff, I need paint, I need, manpower. But what we try to do is we build community capacity, we empower communities, so that once we're gone, once I'm going to some other community or have some other research project, that the project will be sustainable. And we do that by building all these relationships. So, networking the corner store owners with farmers markets and vendors who will work with them and sell them stuff cheaply, so that who believe in the philosophy of improving healthy food access. And so, you work with communities. It takes a lot of time. And it's not easy to do. It takes a lot of good social skills and networking. And it takes a lot of partners. It's a team. I can't do it myself.
Thank you.
Thank you.
I also want to add crowdsourcing. I think it is increasingly important. You're being for example, there's this really cool thing called Kiva Zip. Maybe some of you have heard of it, but they've done a lot of micro lending around the world. But now they have a U.S.-based program. It's online, and you can do. I think that's Pepper International, but yeah, you could get a cow if you wanted to. We can crowdsource for Ron to get a cow on Kiva Zip. And what it is it's actually tell all your friends, and we can all pitch in $25, $5, whatever, and crowdsource a loan. It's a 0% interest loan. And something I didn't know about in college that I want you guys to know about that is really intersects with food work right now is there's a lot of interesting nonprofit financial institutions, community-based financial institutions that are really interested in food and food business and enterprise, and they want to make capital available at low interest rates, and they're trying to figure out how best to do it. So partnering with folks that are doing work on the ground is a good way to go. So that's another resource for financial support.
Thank you for coming. You mentioned about the food stamp program, which is now known as the Supplemental Nutrition Assistance Program. And there have been reports and research that the food stamps program is putting low-income families in food swamps and food deserts into further poverty and also into malnutrition. So my question is, when we're designing programs and we're designing policies, what do we need to think in mind to avoid these unintended consequences that the food stamp has?
I don't think the food stamp puts people into poverty. The thing with you giving food stamps to people who still can't get any healthy food. Okay, so they're still building up these medical problems. I've heard too many stories about people even going to college and things that were on food stamps, and that's the only way they got through college and stuff like that. So that's a good question, but I don't. That's my whole thing with getting people with skin in the game. That's what's so hard. A lot of these people, they don't have no skin in the game. They, especially with food, you drive up and south on a super sauce with a diet, whatever, McSasta, and you drive 20 feet and they hand you talk to a box, and then you drive to a window and they hand you a bag of food. You don't have any skin in the game, and nobody cares what's in this food, but that's what, people are eating this every day. So our food stamps causing, poverty.
I can give just one example so we get more clear, is that with the food stamps program, because it gives like a minimum of $300, low-income families would tend to go for cheaper but hot, more saturated fat foods, and would also refer more to food banks, which are high in canned food, sodium and salt.
So it's having a larger effect on the obesity epidemic and poor health outcomes, as opposed to poverty. I think it's very questions like it's putting more poverty.
Well, I mean, I'm sure she heard that. I heard something like that too. I don't, you know.
The one thing I'll say is that most policy, this is the one lesson you guys, third lesson you guys will learn eventually, is most policy is not implemented with evidence.
Right.
And so, what we really need, and there's nothing it's just an old story. I don't think it's ever going to change. But we need evidence. I mean, we do need the evidence to show what are the patterns to get people who are on food stamps and to get healthy options and access to healthy foods. And how can we work with corner stores and grocery stores and WIC programs? And how can we coordinate all these efforts? But it takes will, and I don't know if in a lot of these governments we actually have the will to make those kinds of transformations.
I also think, you're touching on an interesting point where I'm not sure that the food stamp program, SNAP, or it's called CalFresh here in California, is necessarily designed to improve public health outcomes. It's intended to fill the gap in a food budget for a low-income family and basically address food insecurity or hunger, which doesn't necessarily mean they're going to be getting healthy food, which is what you're talking about. But on the converse, it's been shown that for every $1 of CalFresh spent, it actually generates $1.60 in local economic activity. So there actually is, it's supporting people who, and by the way, most people who are on CalFresh or food stamps are working people. So there's something to look at there in terms of poverty wages that people are earning, that they need to have public support and assistance. Most people on food stamps are working. So it's not like people are just like using the system and trying to get by. They are earning poverty wages so that they can't sufficiently meet their basic caloric intake needs, not to speak of healthy food and health, but to just speak of food insecurity and hunger. So I think you're right. I think it's not the be and end all. It's not a silver bullet, but I would argue it's a really important program, and it's an underutilized program. And especially here, over 50% of those who would qualify in LA County don't use it. And it's one of those things, highly contested political things, right? Where if you don't use it, it's subject to be lost. And I think that really hurts low-income families. Now, could we do more and be more creative about how we can get people excited about eating healthy food using food stamps? Totally. And one example of that is the Market Match program, which basically is a way to match CalFresh dollars spent at farmers markets. So right then and there, it's a win-win. You're supporting small farmers at farmers markets. We all love farmers markets, and it's mostly going to be produce, right, at the market. And you're giving a low-income family the ability to expand and stretch their purchasing power. So now, from $5, they have $10 to spend, and it's not going to be at Wendy's. It's going to be at the farmers market. So that's a way you start to get at both goals, where it's like you're getting people more access to food, which they need, and you're getting them on a healthier track. So I don't know if I answered all of your questions or like what you were getting at, but that's my thought on food stamps.
And that was a good question.
That was a good question.
Thank you all so much for coming. I'm wondering if you guys can talk a little bit about the connections between food justice movements and fat acceptance and body positive movements. I think that like sometimes food justice movements talk about the obesity epidemic, and I think that can be very like fat shaming. How do you guys think we can support food justice without like demonizing people and like certain body types?
Thank you so much for that question, because this is something I think about all the time. And I'm just going to be real right now with my public health friend right next to me. I think what's happening right now in food justice work and food policy work is that a lot of the funding is driven by the public health field, or organizations like the Center for Disease Control, and their objectives are public health indicators, right? They want to see reductions in obesity. They want to see reductions in diabetes. These are important indicators, and I'll let Dr. Ortega talk about why obesity is an important health indicator in terms of other health issues, right? But I really feel strongly that when we talk about health, we should be talking about more than body mass index. You could be very thin and very unhealthy. And I really believe in the health at every weight model. I mean, we're all built differently and we're beautiful. And I think it's a real problem that we're kind of driving this direction where, I mean, just the fact that you're asking this question tells me that there's already been this conflation of food justice and obesity reduction. Obesity reduction doesn't say anything about justice being achieved in communities at all. That, you know what I'm saying? So I just want to appreciate that. That's my response. I don't have a quick answer, but I think by naming that first and foremost, and saying, like, when we talk about diet-related disease or diet-related health impacts, that we're talking about a lot more than obesity. And for me, you know, Dr. Ortega brought up the sort of failed experiment of the new grocery store in Philadelphia, and it didn't bring down obesity rates. Well, yeah, supermarkets don't do that. Supermarkets are filled with a lot of junk food, you know, as Ron was saying. And so if we're really interested in the transformation of our communities, we have to think more holistically. And what success looks like should be way more holistic than did body mass index go down.
I think she's right. And part of the problem that we have in public health is that our projects, our intervention projects, are largely funded by these federal agencies, the CDC, the National Institutes of Health, and they're very disease-oriented. So I have a $10 million project right now that's funding part of the corner store work. And the agency is up my ass right now because they want to see reductions in heart disease and diabetes and obesity in the community as a result of our corner store conversions. And that's really hard to demonstrate. I mean, what I'm likely going to be able to demonstrate is that maybe health, you know, awareness of fruits and vegetables has gone up. Purchase, we would like, because we're doing a lot of social marketing and community events around these corner stores. We're hoping that we'll see an increase in purchasing and consumption of fruits and vegetables. But then to show that that's related then to reductions in heart disease and diabetes is a whole other task. For me, and that's very theoretical, and not something, you know, that we can expect in a 5-year framework. You know, I think you raise a really good point. And, you know, sometimes public health folks, they're so disconnected, even though we would like to think we're not. I'd like to think that I'm not like other public health folks, but they tend to be very, very disconnected from the messages that, you know, they just think, oh, this is a good thing. And, oh, yeah, we should be reducing obesity, and that's a great thing, but not thinking about how the framing of the issue could also have a negative impact on the intervention. He did tell me that I'm one of the hormones in the month, and that I had to lose some weight because I was getting evil out there. He was obesity shaming.
Wasn't shaming, just so you can stay where you are. If you lose weight now, before you go, then when you get there, you can go back up to your normal.
So we're going to talk about this. Any other things? Did that answer your question?
Yeah, thanks so much.
I just had a question about time management. I think one of the biggest problems with food deserts and food availability is that healthy food is cheaper to prepare than fast food if you have the equipment and the hours to make it so. If you have all the tools, you know how to work a kitchen, and you have an hour an evening, you can turn $20 into a week's worth of food for one, so I guess $100 for a small family. It's cheaper than fast food, but it takes so much more time. I think a lot of single-parent families just don't have, or even dual-parent families where they work all day. How do you make your movements work with that?
Well, let's also be honest, that fast food is just tasty. You know, there was a New York Times study, there was a study, sorry, I'm a professor who used to tell us this. There was a New York Times article that talked about the Taliban in Afghanistan, and they were living in these caves, but how they would smuggle in Kentucky Fried Chicken into the caves. I don't know if you guys read that story, you should Google it, you know, Taliban Kentucky Fried Chicken. But like, actually Kentucky Fried Chicken is everywhere, you know, they are everywhere.
In India, it's extra spicy KFC.
So it's not, I mean, you bring up a good point about time management and the ease of making, how long it takes to prepare food, and people just don't have that kind of time. I think that's a good point. Also, people just don't know how, I mean, what we learned in some of our work is we do a lot of cooking demonstrations as part of our committee. Some folks don't know how to cook healthily. Even people, and a lot of people think they're cooking healthily, and they're not. So, there has to be a lot of education as well. So time is important. It's also about education.
Do you have time to die? Real simple. Are you going to make the time? Basically, you make time for what you want to do. You make time for the people you want to be with. Do you have time to die? It's real simple. And you're going to let your food kill you? And that's what this food is doing, it's killing us. Real slow. So my thing is changing food, changing life. You make time to live. It's real simple. That's where my time is going to go. And there's a way to do it fast. You got too many to do this in 5 minutes. They got too many videos. They got this thing called the internet where you can go on, the algorithm, you can get all these fast meals and everything. So no, I mean, it's like that's why I tell the kids, do you want to die? It's real simple. I don't choose to. So you put your time where it's gonna, where you want it to be.
Yeah, I would also add, in addition to learning, so there's like how to cook on a budget, and there's, I think, some good resources out there. Like there's a new healthy recipe book for people on a food stamp budget. But also, I think we should do more around what are time-saving healthy food techniques, because there are ways you can save time, like by cooking huge batches at the beginning of the week and then spreading it out and freezing things. And so I think there's time budgeting strategies too that we can build more into the cooking demo framework. And then also, I think that convenience healthy food products are on the rise, and when we do a lot of work with corner stores and neighborhood markets who are not really ready to have a full-blown produce section in their store, we will encourage them to have quick snacks, healthy snacks, whether that's fruit or yogurt, granola, healthier cereals. So there's better for you products, healthier products that are convenience products too, that are going to be more practical for people who are on the go and don't have a lot of time. And I don't think we should shy away from that being an option for some people too, especially if you're just starting to transform your diet and you don't know how to find the time, or you don't want to prioritize the time. How do you just get healthier products that you can consume right away into stores? So that's another strategy too.
So I just got interviewed today by some reporter in Boston. The 7-Elevens are now offering food that's been created by Tony Horton. Oh, it's Tony Horton, the P90X guy. I'm trying to work him on. And how many of you guys know P90X? How many of you guys have done P90X? How many of you have the P90X DVDs, but it's still in the box, unopened? No, but apparently, so the idea is that he wants to create these healthy sandwiches that are already ready to eat and these healthy drinks. But the problem is that they're selling A in a convenience store, or B, they're $5 to $7 for a drink or a sandwich, which is so much more expensive than a bag of chips or a candy bar, a soda. So we have to, so healthy eating, even when you're trying to improve healthy access to healthy food, you have to be cognizant of the pricing and the economics of food.
Just wanted to add, when you do policy work, how often do you see programs that emphasize food availability while leaving questions of preparation time and preparation training completely out of the equation? I've seen a lot of programs that just focus on, is food available? Well, that's not a very good metric, because if you don't cook the food, it doesn't matter if it's available. You still go to McDonald's on the way home.
Yeah, and I think that gets to some of what we've been touching on, where what does success look like? It has to be holistic. If you're focusing in on one metric, one indicator, well, was food there? Great, it was a success. Not really if you pan out and take a look look at everything that's going on, and that's why I think the study that Dr. Ortega's team is working on is really important, because they're talking to, people who are in the stores buying food, they're talking to residents who maybe haven't even shopped it. I don't know if I'm speaking out of turn, but residents that haven't even shopped at the store before, because they're trying to gauge from multiple different vantage points what's changing, and it's not just, if you build it, they will come. And that's why I emphasize this point about leadership development and training and community building and capacity building, because I think that's what's going to really stand the test of time, is when people's lives are actually changed. So this is the limitation of policy itself, and why you can't legislate change. A policy can start a process, but if that process is not catalytic in a real way for communities, it will fail. It'll be just something on the books that doesn't actually impact people's lives. So that's how I see it.
All right, we'll join me again in thanking all of our panelists. Biochem, all those test the miles. If you need to leave, feel free, but if you want to keep asking questions, we'll stick around.
Thank you, all you people who leave, thank you.
I was so scared you were going to come. Anyways, thanks for coming. I guess my question goes back to what you guys were talking about, and the question was posed about us as a one community and what we can do to change things. And as someone whose dream it would be to start a food revolution, and going back to what Claire Fox was saying about capitalizing on our purchasing power, I know that at Pomona College, it's something that's very difficult to change, is the regulations and ideas that the school has about the community here. And so I was wondering what advice or resources that you know are out there for students like us who are here today who want to create change but don't necessarily know how.
Okay, well, so there's the Real Food Challenge, right, which is a student-led movement on college campuses to transform food purchasing power of universities and colleges, and so they have a ton of resources. We, the Food Policy Council, created the Good Food Purchasing policy, which the City of LA and LAUSD adopted, so we have really robust purchasing guidelines that were actually developed for major institutions that buy, upwards of $1 million worth of food and provide direct technical assistance. So we can be a resource for working with the food procurement officers here at the campus, and we're working with several city departments, City of LA. We're working with LAUSD, which is the biggest food purchaser in the City of LA, and we're starting to talk to some colleges and universities like Occidental College and some hospitals. So that's a resource right there. And then also, the other thing that comes to mind is, for decades now, there's been some pretty robust work around socially responsible investment of college and university endowments. And so I think there's a lot of resources there. It's the same concept, though. It's the same concept. This institution has resources. How are they being invested? Or what are we buying with those resources? So I think between those three categories, there's a lot of tools that you can draw from, and a lot of people who can kind of navigate that, support you in navigating that conversation when you find that resistance or the no, how to turn the no into a yes. It's possible, it's been done, and it's successful, and it makes the school look really good. So it's PR. Yeah.
Thank you.
Thanks, John. That was a great question.
Thank you all so much for coming tonight.